Hi, my name is Stacy Soappman, one of the ASPIRE faculty members, and today we're going to talk about a common wrist injury we see in the clinic. When a patient falls on an outstretched hand, we think of the classic FOOSH injury, and of course, after that fall on the outstretched hand, I would need to look at the wrist, the elbow, the shoulder, maybe even all the way up into the cervical spine. But what I want to focus on here for the next few minutes is the wrist component of this FOOSH injury. So once they've come to us with this complaint of wrist pain, what they're going to say a lot of the times is, my wrist hurts when I'm opening a door, it hurts when I'm putting pressure through here into an extended position, such as with planks or push-ups, anything that puts pressure into extension. So we need to go in, and after we've looked at everything up the kinetic chain, we're down to the wrist, we're going to do a mobility and a stability assessment of the wrist to determine, is something moving too much or is something moving too little? What we're going to focus on today is what I've seen in the clinic over the last few weeks, is that something is moving too little. And specifically that something is the lunate-radius articulation. So to assess that, I come in here with my pincer grasp and I'm going to find the lunate. So I kind of follow the capitate down, move up towards my radius ulna, and that's where my lunate is. And this hand is going to be stabilizing the radius. I hold the radius still and I start to move the lunate in this palmar and dorsal direction. And I'm looking to determine, can it go both ways? So in the case of this pain, when they're trying to push through extension, what I have found lately is that the lunate cannot move in that palmar direction. And I'm going to show you a really quick, simple treatment for that. We can mobilize, but a lot of the times a quick grade 5 mobilization is a faster technique and more comfortable for the patient versus repeated mobilizations here. So I've gone through, I've made sure that the patient is appropriate for a grade 5 technique, I've done my safety screens, and I've obtained their verbal consent. To do the technique, I need to stabilize the underside of the radius and the ulna, so I use my index fingers for that. I take my thumbs and I stick it over the top of the lunate. Put the wrist in a flexed position, give a little bit of traction in here, and then it's a really quick flick, not all the way into an extended wrist position. I need to be careful to maintain flexion to, at best, a neutral wrist position to protect the carpal tunnel, but it's a very quick flick into that direction. We would then sit down and reassess to see if our technique was successful and follow up with exercises to help remind the wrist and the lunate that this is how we are supposed to move when we go into those extended postures with a weight-bearing component to them. So thank you for joining us on this brief technique review. If you have any questions, you can put it in the comment sections or you can check us out at ASPIREOMT.com.